Discussing coronary artery disease is Heart Center cardiologist Dr. Kantaros. What is coronary artery disease?
Coronary artery disease is the leading cause of death in this country. There are over 600,000 heart attacks every year. That's one in every 34 seconds. Every 4 minutes someone dies of a heart attack, so this is a major problem. Specifically, coronary artery disease is a plaque deposit or fatty deposit on the arteries that supply blood to the heart. The coronary arteries run on top of the heart, and their branches go into the heart to feed the beating heart muscle with oxygen-rich blood. So coronary artery disease is blockages of these arteries that can lead to heart attacks, and this is a major problem.
What are the signs, symptoms, and dangers of coronary artery disease?
Well, unfortunately, frequently the first sign or symptom of coronary artery disease is a heart attack, and oftentimes that heart attack can result in sudden death. When you hear about people dropping dead from a heart attack, this is what I'm referring to. The signs and symptoms of a heart attack are sudden onset of heaviness, pressure. People describe it as like a heavy weight on their chest. Not necessarily a pain, but just a pressure. Sometimes it can radiate up to the jaw, down the arm. It can be associated with nausea, sweating. And these are the signs and symptoms of a heart attack, classic signs and symptoms. And if you ever feel these signs and symptoms, you should immediately go to the emergency room. Now, oftentimes people do have some warning signs before they have a heart attack. And what they might notice is if they're working out, exercising, they may suddenly notice kind of a heaviness on the chest or an uncomfortable feeling. They stop and rest, and the symptoms go away. The following day, they go exercise again, and they have that same kind of heaviness, uncomfortable feeling in the chest. This kind of a symptom is something we refer to as angina, which is really the signs of the heart muscle not getting enough blood. So if you were to experience these symptoms when you're exercising, kind of a heaviness or uncomfortable feeling in the chest, this would be a sign of coronary disease and a reason for you to see your doctor.
How is coronary artery disease detected and diagnosed?
There are two main ways that we can detect or diagnose coronary disease. The first way is if a patient experiences some of the symptoms that I've described, heaviness in the chest when they're exerting themselves. They would go to the doctor, and the doctor would order appropriate tests. Alternatively, some people don't have any signs. They can have severe blockages in the arteries, but really not have any symptoms. So based on this discussion with the doctor may order some tests to help determine whether there is coronary disease. And one of the simplest tests that we order is an exercise stress test, where a patient gets hooked up to an EKG monitor, they exercise on the treadmill, and we monitor the EKGs during exercise, looking for specific changes that would alert us to the presence of coronary artery disease. Kind of the next test we would consider is a CAT scan of the heart and of the coronary arteries. And this really gives us a nice picture of the inside of the coronary arteries, help us look for calcium deposits, and can tell us whether there is significant coronary artery disease. I'd say the final test we do once we have a high suspicion of coronary artery disease and we really want to make the diagnosis is a heart catheterization. And a cardiac cath is a procedure where we insert a catheter into one of the arteries. We'll either insert it into the radial artery in the wrist or the femoral artery in the groin. And with an X-ray machine helping us, we kind of thread the catheter up to the heart, and we can put the catheter in the coronary arteries, inject dye, and take a beautiful picture of the arteries to see whether there's blockage or not, if there is blockage, where there's blockage, whether there's blockage in just one artery or there's blockage in all three arteries. So this is really the final test to help us determine if there is coronary artery disease and the extent of the coronary artery disease.